many of you won't be surprised to hear me say that, however, I do see this as just one step in a longer trajectory for where we really need to be as a state and as a country. This system, while it has many merits, still strikes me as being overly complicated and has the feel of something that's been cobbled together, which, it was in many ways a series of compromises, political compromises. And ultimately, I think we need to get something that's much more like Medicare, but extended to the entire population. I think that's where we need to be. I have a particular concern, and I think I'm going to have some legislation this time around this, with the problem of part-time workers or full-time workers who are being made to be part-time to keep them out of coverage. It's a real concern. We're already starting to see that, where employers are proactively reducing the hours of workers so that when the time comes for them to have to cover them, they won't have to do that. That's a big concern, and so I think we need to keep our eye on that. During this last session, we had two bills that were directly related to the issue of Medicare for all, single payer. One was House Bill 2922, which was the Healthcare for All Oregon Act, sort of our initial stab at what a single payer system might look like for Oregon. I was a sponsor, Alyssa and Jackie were also both sponsors of that bill, and we were able to get about 25 co-sponsors for the bill, which was very gratifying and an important step forward. The other bill that we were able to pass, House Bill 3260, sets up a study of healthcare delivery, healthcare payment in the state, and it will be a study of the best way to do healthcare payment in the state, looking at a public option, single payer, just the current Affordable Care Act going forward. And that will be very important, not only for helping us to come up with the most affordable and simplest system that we can have for Oregon, but also figuring out the best way to pay for it in a way that is fair, progressive, and that covers our needs. I'll just close with saying that there is an organization that is working very actively on a grassroots level to bring us to single payer in the state. It's called Healthcare for All Oregon, HCAO.org. I see some people in the room who are affiliated with HCAO.org. The goal here is, obviously, to make a change, to bring single payer to Oregon will require a vote of all Oregonians. And ultimately, it will take 1 million people voting for it. And the only way that we can get 1 million people to vote that way will be through steady, grassroots, neighbor-to-neighbor, family-to-family member organizing. And that is what's underway now. And I would really encourage you to contact HCAO.org, to talk to any of the activists. There are local chapters being set up in every community. That's what it's going to take to get